Hello and welcome to the COVID-19 vaccine telephone support volunteer training. My name is Sydney Shutro and I'm the Director of Volunteer Engagement at the Tennessee Commission on Aging and Disability. I'm joined by a couple other staff members who I'm going to let them introduce themselves here in a moment. But before we get started, we truly wanted to thank you all who are able to attend the training today and those who are listening to the recording. For your commitment to helping older adults across Tennessee receive the COVID-19 vaccine. We have everyone on mute to help reduce those background noises. So I encourage everyone, if you have questions or comments throughout the presentation, to use the chat box. So I have a little image on the screen here, a couple little housekeeping things before we get started. You'll notice kind of in this top right-hand corner, you have a layout button. Some of the information as we get to looking online at websites might get pretty small in your viewing screen. So if you're able to click that layout button and then click stack when it comes up, I think that's really going to help enlarge your screen and make it easier for you to see some of the things that we're going to look at kind of down the line. So in terms of asking your questions, we have Nikki Richardson, who's interning with us and working on her capstone project for occupational therapy. She's going to be helping manage those questions in the chat box and also recording attendance for the training. So thank you, Nikki, for your help. We really appreciate it. This is a new volunteer opportunity that we have been developing for a little less than a week. So we put a lot of this together rather quickly, and there may be some things that we don't know the answers to just yet, or some resources that need to continue to be developed. But it's going to be an evolving process that you all will definitely have a say in as well. So we're going to cover a lot of material, but as you start to make calls, there may be scenarios, like I mentioned, and resources that we haven't thought of yet. So please feel free to reach out to us anytime. Let us know how we can help, ask any questions that you have. What you think is going to be helpful, I'm sure your fellow volunteers are also going to find to be a valuable tool as well. So since we're doing this program remotely and we have our cameras off to reduce distraction, I thought it would be good for you all to be able to kind of put a face to the voices that you're hearing. So I introduced myself already, but I'm Sydney Shutro. I've been at the Tennessee Commission on Aging and Disability for 8 years. And I'm currently working with our programs to help recruit, train, retain, and engage volunteers, much like yourselves. And I'll be your main point of contact for this project, but you're also going to hear from one of my coworkers who I'm going to turn it over to him and let him introduce himself.
Thank you, Sydney. My name is Ryan Ramsey. I also work at the Tennessee Commission on Aging and Disability, specifically for the Tennessee SHIP program, which offers free unbiased assistance to older Americans, Medicaid questions, financial assistance. In a normal year, we would provide outreach to the community as well to help educate, go to health fairs, and also train our team of volunteers to help assist people with those same topics. And just a little bit about TCAD, that's the Commission on Aging and Disability. Y'all will forgive Sydney and I, hopefully. We are quite accustomed to some of these acronyms that we use pretty often in our daily work. So if there's any sort of acronyms or anything like that that is foreign to anybody that possibly she or I or even Nikki skim over and you don't know what that acronym stands for, just type that down in the chat and we'll absolutely make sure that we cover that one more time so we can make everything clear for everybody. But just to give you a little background on the Commission on Aging and Disability, we are a state unit on aging that offers free non-medical related services to our community in Tennessee. We do that through the receipt of both state and federal funds. And we also do house several statewide programs Some of the things that we do administer would be options for community living. That would be some in-home care, meals, homemaker and personal care services. The public guardianship program, which is a court-appointed guardianship program for both financial, medical, and legal decisions for older adults who have become what is essentially wards of the state there. The ombudsman program, which are advocates for persons in nursing homes and other long-term care institutions. Some nutrition services, meals at community locations or even home-delivered meals. Elder abuse prevention through both outreach and education about frauds, scams, and domestic violence affecting seniors. Some caregiver support with helping families provide better care to their loved ones. The SHIP program, which again I covered just a moment ago, but we offer free unbiased assistance to older Americans about Medicare and other insurance-related issues. And then, of course, we do fund about 120 plus senior centers. For anybody who is unaware, there are 95 counties in the state of Tennessee, and we do have a senior center, at least one senior center in each county. In addition to funding those senior centers, we also do fund and contract with 9 different area agencies on aging and disability to also carry out a lot of these same programs that we've just covered. And of course, you can go to our website right here to find all sorts of information on each one of these programs. But if you are looking for some regional specific information when it comes to these programs, we'll cover just a little bit of information about the state and what regions each one of these area agencies cover. So this statewide number right here, if I'm not mistaken, is the INA hotline. That's the toll-free hotline there where people can call in and get referred out to each one of these specific programs at one of these AAADs. This colorful little map right here is probably something that we use nearly every day when it comes to looking through our state. I do, especially in my program. This map right here shows the different regions of the state that we all cover and what counties in particular fit within each region. If we'll just go from left to right really quickly here, that in the bottom left-hand corner there, that is the region, the Community of the Mid-South right there. That's ACMS, Aging Commission of the Mid-South. Right above that, in a light blue, baby blue right there, we'll call it, is Northwest. That is sort of the UT Martin, Martin, Tennessee, Weakley County, Obion. It's a rural Northwest portion of the state. ACMS, I should mention, was covering the Memphis area, essentially. Right to the right of ACMS there is our Southwest region. That covers essentially what is the Jackson area and the area surrounding Jackson, Tennessee. Moving right to the right of that is the area which is South Central right there. That's sort of covering down below the area that Nashville's in. Places like Coffee County, Franklin County, Maury County are down in that region right there. Right next to that is the Southeast region. That's the Chattanooga area right in there. Above that is Upper Cumberland. That will be your Cookeville area right in there. And then moving on east right there, funny I say that because that's the East Tennessee region right there, which is sort of your Knoxville, Pigeon Forge area right in there. And then lastly, the easternmost portion of the state, that would be First Tennessee. That's your Johnson City, your Jonesboro, Kingsport, Bristol. For anybody who's a racing fan, Bristol's also located in that region right there. And each one of these numbers right there are specifically for each one of these agencies on aging and disability. But that toll-free statewide number there also routes automatically, depending on what portion of the state that person is calling from, it routes automatically to their nearest area agency on aging and disability right there. And we will, thank you, Nikki, we'll go into further detail about the INA number later on in the presentation here. Okay, so what is the purpose of what we're trying to do? The purpose of what we're trying to do is use a wide variety of trusted sources to work with our community to try and impress upon them the importance of scheduling their vaccination to receive the vaccine. Oh, excuse me, sorry, INA. INA stands for Information and Assistance. Sorry about that. See, I knew it would happen at least one time that I moved through one of those without explaining myself. So yes, that is Information and Assistance. So our purpose is to try and impress upon people the importance of trying to get that vaccination and empower them and enable them to be able to get that vaccination should they desire to want to do that. We definitely do want to avoid the language of requirement or mandate. It is not something that we are trying to tell people that they have to do or are going to be forced to do, but just to educate and inform people about why getting that vaccination is very important, and to help them be able to have all the correct information from a trusted source so they can make that decision for themselves and be able to have some assistance getting signed up if they are unable to take care of that themselves. And we definitely do want to watch out for misinformation when it comes to this as well. Unfortunately, right now, there are quite a bit of scams that are going around regarding the COVID vaccine. We definitely do want to make sure and inform people of a few things that they should be aware of when it comes to somebody contacting them about this vaccine. You should never have anybody calling you and telling you that you're going to have to pay for any sort of the services of getting that vaccine. If you're asked to pay out of pocket to get that vaccine, that is absolutely going to be a scam. Also, if you're asked to pay to put your name down on a wait list for that vaccine or to get early access, that is most definitely a scam right there. And we will see this scam going on through many different sources, social media platforms, emails, telephone calls, any sort of online chat system may be an avenue for places for people to attempt to perform these scams on people. And any sort of marketers offering to sell or ship doses of the vaccine for payment, saying, hey, if you send me this money, we'll send you a vaccine that you can take to be administered for you, that's definitely going to be a scam right there. Any sort of exchange for any sort of monetary information or any sort of information that somebody may feel uncomfortable with giving out could be a sign of scams. And Sydney will know this very well. We've dealt with a lot of insurance scams over the year. there's absolutely no reason why someone cannot hang up on anyone who's calling if they suspect, even for a second, that whoever is calling, it may be a scam. Absolutely, you can advocate for them to hang up on that person and either call that number back or reach out to, somebody within the program and say, hey, I just want to make sure that this is legitimate, and they can do their research and find out if that is going to be a scam or not in that. So if you just go to the next one there.
Brian, I have a quick question.
Sure.
So I know you mentioned that there's no money to get the vaccine. However, I believe a little caveat to that is if you go to a doctor's office, the doctor can charge you an office visit copay. Is that correct?
Yes, that is correct. But there should be no copay for the actual vaccination. If your doctor is going to charge you your in-office visit copay that goes along with your that goes along just with the making an appointment with that doctor, that is absolutely well within their right to charge that copay, but not charge for the actual vaccination.
Great, thank you. So I'm gonna take the mic over for a little bit and we're gonna talk about some expectations. So we wanted to give you just a little bit of background to start off the training. So you all have seen this when you reviewed the volunteer role description before you emailed me back and said, yes, I want to try this. But I did want to emphasize a few things that'll be key in making this project successful, not only the project as a whole, but also successful for you all as volunteers. So we do hope that everyone can call at least 20 older adults for this project. Many of you have responded saying, I can do way more than that. Some of you have said, I may not be able to do that many. So we understand if you can do more or less. 20 would be wonderful, but we understand things happen. Many of you are students or have jobs or maybe are caretakers. So just let us know how many people you can call, and every little bit helps right now for sure. So we do ask that you complete your calls within a 48-hour period after receiving your lists, which we do plan on starting to send out lists tomorrow morning. So I know this is a really fast turnaround, like extremely fast turnaround, but I will give you a little bit of justification as to why we're asking this to be done so quickly. So the Department of Health is opening vaccinations up for people 65 and older starting on Monday. They just released that yesterday. It was March, so we kind of have a little bit of a deadline to get these individuals who are 70 and older to get their vaccination before an even larger number of people become eligible to receive it. So we do hope that we can loosen this requirement slightly in the future. So as our list grows and we include those individuals who are 65 and older, we may be able to increase that 48 hours to 72 or even more possibly in the future. Since the weekend is coming up, for anyone who's getting clients or people to call tomorrow, we can definitely extend that through the weekend and give you guys ample amounts of time to call all your people. So we do also have specific questions that we'd like you to ask each person that you call, and we're going to look at an online form here in a little bit that's going to actually show you all those questions that we're going to ask you to talk about. If the person you're talking to wants to help scheduling an appointment to receive the vaccine, we want you to be able to schedule that appointment for them, with them over the phone, making sure they're available and all that good stuff. So I will let you know, and we're going to look at the Department of Health's website as well to give you more experience working with that. But some counties are going to have more availability of appointments than others. So there may be times that you have to add someone to a waiting list and they'll receive some updates via email and text messages on when their appointments become available. So we can't necessarily guarantee that when you go to schedule a vaccine an actual date and time will be set when you're on there. We know one of the barriers that people are facing to get the vaccine right now, and this goes for older adults and other people as well. It's not just specific to these individuals we're working with, but getting transportation to that appointment has become a challenge and is preventing some individuals from getting the vaccine because they have no way to get there. So one of the questions that we are going to ask you to ask the people you're talking with is if they need transportation assistance. And you all have received an email from me beforehand that gave you our transportation resource guide. So if anyone needs assistance with that, you have the resources to be able to provide them the phone number and the agency so they can call and get a ride to their appointment. It's extremely important for this activity and this project in particular that you have access to a phone and the internet at the same time. So between talking to the person, scheduling appointments, and completing an online form requirement for each person, it's really going to make your life a lot easier if you have a couple devices that you can work off of. And last but not least, we understand that things come up or what you signed up for is not always what you expect it to be, no matter how much we prepare you. So after you go through this training, you might say, maybe this isn't exactly what I want to volunteer for. It wasn't exactly what I was expecting. If for whatever reason you're no longer able to volunteer with us, please let me know as soon as possible. I promise I'm not going to shame you. I'm not going to say we're never going to speak to you again. If you want to remain on our volunteer list for future opportunities, we're happy to continue to send you those updates, and maybe at a later date you'll have a better fit for a different project. So talking about reporting requirements, some of you, I'm arguably the least fun part about volunteering, but the most critical part to this project in particular is reporting. And I apologize, I'm seeing that I'm possibly getting some mic interference, so that might have been when I was changing my notes. So reporting, it's the least favorite or least fun part about volunteering, but it's crucially important that we get the reporting that's needed. So before we actually look at the form, I wanted to talk to you about why this reporting is so important, especially for this project. So data is the number one important thing. With any new program or project, data is extremely valuable. By the end of this project, we'll be able to show how much impact you all have had across Tennessee with helping people get vaccinated. We may also be able to find trends or other barriers that are preventing people from getting the vaccinations. So if we're able to find a barrier, we can work with our partners and find a solution faster than if we didn't know anything that was going on. So you guys are going to play a huge role in making sure vaccinations become more accessible across the state. Checks and balances. So we do need a system in place for this. That's where the electronic form that we're going to look at here in a second comes into play. So we'll be able to review and confirm that every person that I send to everybody is contacted or at least attempted to be contacted. I'll be able to report back to our partners, our governing bodies, kind of give them a report on the progress that we're making through all of our lists. We do know of some challenges. So we know of at least two hurdles that people are facing right now. The first is many older adults do not have an email address. And right now, email addresses are required to register for a vaccination appointment. We're going to talk about that scenario here soon. So more to come. Another challenge, as we mentioned a little while ago, is the transportation to getting to and from their appointment. So we have that resource list. We'll also talk a little bit more about that. But again, if you see any other challenges or obstacles as you're talking to your people, please let us know as soon as possible. So we are going to look at this form. I mentioned at the beginning that you can kind of look at your layout to make sure this goes a little bit bigger for you because it's kind of hard to see. So try and expand your screen as best you can. So this is our online form. You're also going to be able you're going to be given these questions in a Word PDF document as well. So you'll know what questions we're going to be asking you to talk with your individuals about. So the first thing we're going to need is the client's name, phone number, and county of residence. I'm going to give you this when I send you your people tomorrow and hopefully in the future as well. So you're going to have all of this information before you even start calling someone. We're going to ask you if you actually spoke to the older adult. So if you did, great. It's going to go on to the next question. If you weren't able to talk to the older adult, it's going to ask if you were able to leave a message or maybe they hung up on you. Ryan talked a little bit about scams earlier. Sometimes when you call an older adult for this project, they might think that you're a scam and they may hang up. Don't take offense to it. They're doing kind of exactly what Ryan told them to do, right? So let's assume that our older adult, you are able to speak to him or her. We're going to ask them if they've already had the vaccine. If they've already had the vaccine, we're going to ask them if, well, this doesn't make sense. If they've already had it, do they need transportation to get to the vaccine? I'll update this form. See, I'm glad we're doing this. So if they've had the vaccine, then great. We're going to tell them, you know, we're going to put that in our notes. We're glad you've already gotten the vaccine. So if they have not gotten the vaccine yet, we're going to ask them if they'd like to receive it. Again, as Ryan mentioned, we're not going to use any kind of wording like being mandated or required to receive the vaccine. So just asking them yes or no, whatever they would like is their decision. So if they say no, then kind of the call is done. We thank them for their time. But if they would like the vaccine, we're going to ask them if they already have an appointment. If they do, great. Thank you for their time again. But if not, we're going to ask them if they need help scheduling the vaccine, an appointment for the vaccine. Hopefully they say yes. If they do say yes, then we're going to ask them if they have an email address, because we talked a little while ago that it is required to have an email address to schedule the appointment. So if they do, perfect. You're going to go ahead and be able to work on scheduling that appointment. If not, unfortunately, we're not going to be able to schedule them for their vaccination. What we are going to do is we are going to put them on an in-house waiting list. We're working with a lot of our aging partners across the state to try and set up events at more localized places. So if we can get a list of people in a certain county that we know an event's coming up, we're going to be able to talk to those individuals and maybe get them in an in-person event rather than trying to schedule an appointment online. Also, if they are wanting us to help them schedule an appointment, we want to ask them that transportation question. So if they do need assistance with transportation, again, you're going to look at that transportation guide and give them the name and phone number of the resource in their county. We need this information for every person that you contact. So please be sure, even if you leave a message, even if someone hung up on you, if you're not able to contact them, we need this form so we can do that check and balance that we just talked about to make sure at least a contact was attempted. Also, every time you talk to someone, we want your input on how the call went. So we want you to tell us, were you able to sign this person up for a vaccine? Yes or no? Or does the person need to be added to our waiting list because they did not have an email address? So we want to make sure that they're comfortable being on our waiting list and not just assume that we should keep them on there. We also have a space where you can type in any information that you feel is important for us to know. So maybe it was the client didn't have an email address, but they're going to contact their daughter or son and have them help. So at least we know there's going to be some progress made in getting a vaccination scheduled. So we're going to ask for your name, again, a check and balance. And we're also going to ask you to tell us how long you spent on the call. So when it comes to your volunteer time, make sure you include the time that you were on the call. If you had to leave a message, completing this form is also your volunteer time. So give yourself credit for all the activity that you're doing. We are going to go over some scenarios here a little bit toward the end, so I know a lot of questions are probably coming in. We will work to address those here shortly. I promise. We're not ignoring you. So next, we're going to talk about scheduling an appointment. So on Monday, the Tennessee Department of Health launched a new website for vaccination appointments. Some of you, when I asked if anyone was interested in this volunteer opportunity, you all let me know, oh, I've helped friends and family schedule an appointment. So some of you have experience, which is wonderful. Not required. So for those of you who don't have experience scheduling a vaccination, that's okay. It's all going to be a learning experience. But I did want to let those of you who have experience know that it's actually going to be a new website that you may not have seen before. So we created a print screen guide for you to navigate through the website as well to better prepare you for questions that'll be asked when people call you. So this is kind of a print screen of the print screen guide, but you have that in the email that was sent to you earlier as well. And we're going to move over to their website and just kind of look at it real quick. Normally I would tell everyone, you know, play around with it, but this is a serious website, so I discourage you doing that unless you have someone who you're really helping. We can only get so far without having an actual person's information to type in. We're going to get through the website as much as we can. So here's their homepage. We're going to proceed to COVID-19 questionnaire. You can see at the top here, it's going to give you a status bar. So you kind of have an idea if someone says, you know, I only have 5 minutes to talk with you about that. You'll be able to show them a progression of, hey, we're halfway done. Hang in there just a little bit longer. So they are going to make sure that you're not a computer and you have to type in the little code stuff. If I can do it correctly on my first attempt. Yay, and look at that, we're already 16% done just doing that. They're going to ask if you're currently working or volunteering part-time at any of these locations. I can tell you this round of individuals, it's going to be less likely for them to be currently working, though it is possible. You know, nothing's impossible. Just asking these questions to verify, don't assume anything. Make sure you have accurate answers to all of these questions. So for the sake of our example, I'm going to say none of the above, and it's going to ask you, of course, subsequent questions after that. This website is using the Department of Health. So as we schedule these are going to be vaccinations that are scheduled with local health departments. So again, look at all these. I'm not going to read them verbatim to you. You guys have the guide and you guys can look at the website. But for the sake of time and just kind of this example, I'm also going to say none of the above for if any of these following apply to me. Do we work in any of the following medical settings? You can see all of those there. I'm also going to click none of the above, and it'll continue to ask a few questions. I've done my best to make sure print screens of all of this are available to you in that guide. So look through that, and if you see something that I missed, please feel free to let me know. So I'm going to mark none of the above for this as well. It's going to move us to the next set of questions. Here we go. We're a little bit more progress. Do you currently work in any of these settings? No, I don't. If the person is over age 16, which I can tell you, all of the people you will be calling are over 16. Right now, we're working on individuals who are 70 years of age or older. We can ask them about these chronic conditions. I'm going to say none of the above, again, just for time's sake. Do you currently work in any of the following social settings? Look through these, ask them. Again, I'm going to put none of the above. Currently work in any of the following services? Again, I'll say none of the above. Do you live or work in any of these high-risk settings? Again, going through the list, I'm going to click none of the above. And we're going to move along through the questionnaire. 50% done, we're almost there. It is going to ask, will this be your first dose of the vaccine? Yes, or you could say no if someone needs help scheduling the second dose. History of any allergies, and all of these questions you're going to ask the yes or no questions to. For the sake of time, I'll say no for all of those. This is where we're going to have to stop our review of the system, but this is going to show you all the information that you're going to need from the individual to finish the registration. So you will have their first and last name. Double check, make sure they don't, we didn't send you a Bill when they're actually William, that kind of a thing. Address, we will not be able to send you the address, so you will have to ask them their address. You will have their county. City, postal code, state, it will be Tennessee. All of the people that you're calling are going to be within the state. Here's that email address. So this is why we asked the question on the questionnaire that we're asking you to complete, is because you don't want to get through all of this, ask them all these questions, and then they say they don't have an email address. So be sure to work off of the form that we just looked at of what we'd like you to ask your people to make sure you don't get through all of this and then you can't complete anything. So there's the email address, cell phone number, alternative number, race, ethnicity, gender, and date of birth. You'll need all of this information from the individual when you're talking to them to be able to register. And like I said, I'm not able to show you any further. I'm sure as you go deeper in, they'll have more of the appointments available, and then you can work with the individual on a date and a time that would best suit them. All right, so that's scheduling appointments. So I'm seeing there are, like I mentioned, quite a few questions that are coming up in the chat box, and I think some of these questions are going to be answered as we go through these possible scenarios. So see if any of these get the questions answered, and then we'll talk with Nikki to see if I need to do any type of clarification on anything that she's seeing come in. So the first possible scenario is having to leave a message for someone. And these common call scenarios, we're actually working on putting into a guide for you as well. So no need to take notes if you don't want to. We're going to have all this again to you in a PDF format, so you have some ways to handle these scenarios. So leaving a message, an example of a message that you might leave is, hello, this message is for Ryan Ramsey. My name is Sydney Shutro, and I'm a volunteer with the Tennessee Commission on Aging and Disability. We're working with the Tennessee Department of Health and the Governor's Office to make sure everyone who's interested has access to receive the COVID-19 vaccine. If you need help, please feel free to give me a call back at 615-741-1585. Thank you, and I hope you have a great day. Now, I use my phone number. We do ask that you use your phone number if you're willing to do that, to have the person call you back if they're interested in help scheduling that vaccine appointment. We put together not necessarily a script for you, but just some suggestions on language to use when introducing yourself. We like this language because it tells them that you're a volunteer with a credible agency, that we're working with other credible agencies with the Department of Health and the Governor's Office to help the person understand that we're not a scam. And that we're really trying to help them, and we're working with legitimate, credible sources like Ryan mentioned earlier in the presentation. So another scenario is that you can't leave a message or you're hung up on, possibly. So if you're not able to leave a message, we do ask that you try and make at least one more attempt to contact the person. Maybe it was just an off day, maybe they didn't have their voicemail set up, or just rang and rang and rang. We've had those calls before. Try to make just at least one more attempt to contact the person, either within the next day or so. If you're hung up on, we got the hint. You don't need to do a follow-up call with that individual. They probably just don't want to talk to us, and we understand that. If the person has already received a vaccine, we're going to let the person know that we think that that's great. We're happy that they got it, and that we're going to include that information in our notes, and then we're going to thank them for their time. Really, we don't have to go into any more of our questions. We can kind of end the call right there. The person already has an appointment. Again, wonderful. And we'll include that in our notes, and we'll thank them for their time as well. We also may want to ask, if they already have an appointment, do they have that transportation that's needed for them to get there? Just an additional bonus question if we feel like it's appropriate. Which I think actually is a smooth transition into the next scenario. I jumped ahead of myself a little bit. Sorry about that. So again, we want you to use that transportation resource list, and we will send that out to you again here in the follow-up this evening. So you have that as a resource. Just a little bit of background. Sorry about that. So use the transportation resource guide. Verify the county that we've sent you is correct. We are going off of our client list, but you never know. We talked to this person 6 months ago. They may have moved. So just be sure before you give out any of those transportation resources that you have the correct county of residence that they live in for those services. Another scenario, the person needs to make an appointment but does not have an email address. We done this a little bit ago. So something you may want to consider saying is, unfortunately, to schedule an appointment using the system that we have access to, an email address is required. So we are keeping a list of people who are not able to schedule an appointment right now, and we'll add yours to it if you're okay with that, to let you know of any events that may be coming up in your area. We also recommend that they ask a family member or friend who has an email address if they'd be willing to help, and maybe keep that person informed of any updates that they receive about your vaccine. So, and then asking them if they have anyone that they can work with that they know to help them schedule that appointment. Another scenario, the person wants help with an appointment, has an email address, and needs transportation. This is your time to shine. This is what we're training you for. This is doing everything. So use that vaccine appointment guide that we provided to you. Complete the registration on the website that we just looked at. Once that appointment is complete, use the transportation list that we provided and give them the name and number of the program to contact to schedule a ride. And again, verify that county so you give them the appropriate resource. I think this question came up earlier, possibly in the chat box. So a client has a question about other resources that has nothing to do with COVID-19. Maybe they have a food need, or they need help with medication or insurance or something along those lines. It can vary widely. That's where we would recommend that Area Agency on Aging and Disability number, or the AAAD number that Ryan showed a little while ago. So you can look at each region. That might be a little cumbersome. It's kind of a small map to look at, but you always have that statewide number. And it's in your resources, but I'm going to tell it to you now. And Nikki, if you want to type this into the chat box maybe for me. So the statewide number is 1-866-836-6678. And what that number does is when you call it, it's going to route you to the appropriate region, to their information and assistance line, or the INA line, and get them help finding services that they need. The last scenario that we can think of, and we may have some more scenarios that come up in the chat box, but the client or the person that we're talking to has a friend or family member who also wants help. So we do want, through this project, to help as many people as possible get vaccinated. So if someone has a friend or family member who needs help with an appointment, please get that name and phone number of the person. And if you can, add them to your call list. We understand that you may not be able to do that. So if you're not able to call additional people, please include that new person's name and phone number in that notes section of the electronic form that we looked at a little while ago, and we'll assign those individuals to a new volunteer. So we've always worked with kind of the no wrong door approach, where if there's a question we don't know the answer to, we're going to refer to a source that will have the answer. So getting that information, and we'll find someone to be able to help assist make that call. So those are kind of the 9 common scenarios that we think that you'll face. Of course, there could be some off-the-wall scenarios that you encounter, so please let us know, and we can update the guide as we get more scenarios. Before we get into some chat box questions, just some additional helpful resources that we're going to provide you is, like I mentioned, we have the questionnaire in a PDF format, so you're going to be able to see all of those potential questions that you're going to ask someone who you call. You know, if you spoke with them, if they had the vaccine, all that good stuff. We are going to send you the transportation resource list again. This list is organized by county. So instead of trying to, you know, find the county on other sides, if you know the county of residence, you should be able to find that resource fairly easily. There should be at least one transportation resource. Well, I shouldn't say there should be. There is at least one transportation resource per county. So you can see, for example, in our screen here, we have Anderson County, which is in the East Tennessee region. They have 3. And looking down the list, you can see some have more than that. We're also going to send you, or you should already have, the Area Agency on Aging and Disability map. So you can see the individual phone numbers. Again, if you're not as familiar with the area of Tennessee, just use that statewide number, that 1-866-836-6678 number, and the person will be routed to the correct region. We can't guarantee that the people that you're going to call are in the county or even in the region of the state you're located in. So if you're in the Nashville area, it's possible you may be calling somebody in Memphis. What we are going to do our best to do is make sure that you have specific county or just a couple counties that you're going to be working with. So that way, when you go into the website to schedule vaccinations, and you're in Anderson County and you have 5 people in Anderson County, you're going to kind of know that process rather than having one in Anderson and one in Davidson and Cheatham and just kind of all over the board. We're going to try and keep you with as few number of counties as possible, just to make it a little bit easier for you guys. That's the goal anyway. We're also going to send you the flyer that Ryan talked about protecting yourself from scams. So if you wanted to share information with the people that you're talking with about how to avoid those, you have that resource. And we also have the common call scenarios, those 9 questions that we just kind of answered briefly a little while ago. You'll have the scenario and then kind of a message or a sample script that you can go off of to help answer any of those questions that come up. So we have these in addition to that vaccine appointment guide. So you have many, many resources, probably too many to keep track of. But if at any time you're missing something or you've misplaced something in your inbox, let me know. I'm happy to send you any resources that you need. Most of these resources are going to be continually updated as we get more information or things change. So the call guide scenario guide that we're talking about, with the common call scenarios, is a great example of this. So again, if you guys experience a scenario or from our notes, we see that there's a trend of new things that are coming about from what you guys have told us, we'll continually update these resources so you have the most up-to-date resources to give individuals that have questions. So we're almost to questions, but I wanted to give Ryan a chance to do any kind of final thoughts that he wants to add to what we've been talking about, and then Nikki will turn it over to you for questions. So Ryan, do you have anything you'd like to add?
Thank you, Sydney. Yeah, I just wanted to add to everybody sort of something that springs to mind when it comes to all of this is you know, just being in a program that we are primarily phone based in SHIP. I did just want to kind of let everybody know that if you do happen to speak to somebody who is, let's say, having a little bit of a rough day and might be a little bit disgruntled, it's always good to just remember that this person is not really attacking you or is not angry at you. They're angry at what, you know, they are perceiving out of the situation. If anyone is to sort of get a little bit angry or anything like that. I always try to employ the 3 strikes you're out method. You know, I believe that Sydney and I and Nikki, all 3 of us would agree that we under no circumstances expect anybody to sit and endure, you know, a verbal lashing from anybody. How I always try to handle the situation is explain who I am again, very calmly. You never want to match anybody's level on anything. If somebody continues, just ask them calmly to, you know, please, you know, don't yell at me or speak to me like that. And if they continue to do that, then just say, okay, well, I'm going to have to terminate this call, and just put that in the notes. Make a note that this person, you know, was not being polite, and therefore I had to terminate the call. That's absolutely understandable. I would say that out of the tens of thousands of people that, you know, we've spoken to on the phone, I cannot remember, you know, the positives are overwhelming over the negatives, but I always do like to just prepare anybody when they're getting on the phones that, you know, that is always a possibility. Just remain calm, keep your you know, your emotions low, because ultimately, if somebody does not want our help, that is not up to us. We are here trying to do a service for everybody. And ultimately, if somebody does not want to employ our services to do that, that is entirely up to them, totally understandable, and that's okay. So that's the only point that I wanted to make sure and make, Sydney.
That's great advice. Thank you, Ryan. Nikki, do you have any questions from the group that you'd like to ask us? And Ryan and I will kind of tag team answering those.
Oh yeah, I'm going to start. Well, actually, the first question I think ties really well into what Ryan was just talking about. Is Deborah had asked, what if the people we call do not want to give us their personal information? She doesn't provide information over the phone. So can the volunteers just give them the AAAD's number, or what do you guys recommend in that situation?
So in order to schedule an appointment, whether they talk with us or the health department themselves, they are going to have to give that personal information to someone. So if they want to give it over the phone, I definitely understand that, and that could be a common scenario that we should add to the guide. If you'd make a note for that for me, Nikki. We can also give them the website if they wanted to schedule the appointment themselves and they just didn't know where to do it. But kind of unfortunately, no matter which avenue they take, personal information is going to have to be provided. Now, it's possible in that situation, maybe you ask if they want to be put on the wait list, and then we can tell them about local events, and as much personal information may not be needed. For example, if it's at the local senior center, they may just have to call up the director and say, I want an appointment, and then they'll get scheduled, and they may not need all that personal information. So as of right now, you'll need it, but there may be some options in the future that not as much will be needed.
And then Jan asked, so we need to complete an appointment form for every person we call, right? So I think maybe Jan might be confused that there's actually 2 separate forms. There's the form that TCAD is having you fill out based on who you call, and then there's the form that you'll fill out that's to actually make the appointment for your older adult.
Absolutely. So Jan, the only form that you have to complete for every person that you call is this one right here. And it's going to be included in the resources we give you that kind of has a little bit of a script to it, but at the same time, it's hard to have a perfect script for these conversations because there's so many different ways that the call could go. But it will be included in your materials. So it kind of has an intro at the top, and then the questions that we're asking you to ask the person. It may or may not be the case that you do this scheduling of the appointment. So this is more possible, but not guaranteed that you're going to be filling out this vaccination registration. So this is just to schedule the appointment. That's possible, maybe not. Whereas the questionnaire that we're asking you to fill out is going to be for every single person. And I'll clarify that in the follow-up email as well. Great question.
And I will just point out to everybody that all of that information that you see up top there, client name, phone number, county, just to remind everybody, all of that information will be on the lists that we do give out to everybody. So you won't have to have them give you that information. You'll already have that information.
Okay, and then there were a couple questions about transportation. So the first one, Deborah asked, and it's about seeing that Lyft is donating rides, but we don't have them listed on our resource guide. So maybe Sydney and Ryan, you could give some guidance about that.
Yeah, Deborah, if you wouldn't mind sending me information that you have on Lyft, we're always going to be looking to update our transportation resources for you guys. This morning, we just had one of our agencies send us a couple more resources in Shelby County. So that's another resource that we'll continually have updated for you. But yeah, if you could send me some information on that, I'd love to include it so everyone has that resource.
And then just for clarification, Jan asked about if you offer transportation information, it will be the responsibility of the older adult to call that number and schedule the transportation for themselves, correct?
Yes, that will be on the individual to call and get that transportation set up. That's a lot of information for you guys to coordinate. So it's best to give them that information. And if you wanted to kind of go above and beyond, maybe in a day or two, follow up with that person and see if they made that call to the transportation resource. Not a requirement, but if you want that peace of mind to see if they followed through with that request, that's something that you can do.
Okay, and then going back to the beginning, just back to scheduling appointments. Ellen had asked about if I put someone on a wait list and they get a call back for an appointment, what kind of follow-up should we do to make sure someone actually got vaccinated?
Right now, we don't have a protocol for that. So if you do have to put someone on a wait list through the Department of Health's website, that's kind of the end of our project mission, so to speak. You're welcome to continue to have contact with your person, and we may, in the future, we're definitely going to have the data to support who was put on a wait list and who wasn't. So we may follow up in the future, but that's not something that has to be followed up with at this time.
And then in terms of second appointments, there were a few questions about this process being for, mostly this process that we're outlining is for people signing up for a first vaccination only, but the volunteers are asking, what if the older adult asks them to schedule a second appointment, or if they're having a hard time finding an appointment to schedule because it's harder to find appointments for the second shot. And then also, what if older adults had an appointment this week during the storms, and will they receive an updated appointment automatically?
So I can answer the first question, can't necessarily answer the second. I'm not sure how they're doing rescheduling of appointments that may have been canceled. They'd have to contact whoever they scheduled the appointment with to verify when that would be rescheduled. Working through these questions real quick, because there was a part of the form that asked if this was your first or second dose of the vaccine, and I think that's going to help us answer that first question. Where is it at? Here we go. So when you're about halfway through the form, it's going to ask, will this be your first or second dose? So if it is their first dose, we put yes. If not, then they're going to ask you additional questions. Did they book their appointment through this portal, meaning through the Department of Health's website? If yes, then they'll have to answer questions about that vaccine. If not, They probably did their first vaccination through another source that they'll have to contact directly to see how to get that second dose. That may not have answered that question. I told you at the beginning I may not have all the answers, but that's where I would definitely start in seeing if someone already had their first vaccine but are waiting for their second.
Okay, and then a couple of volunteers were asking, one question from Linda is about if they don't want to give out their personal phone number, like when they're leaving a message, what phone number should they give?
That is a good question. You can leave my office phone number. That'll be fine, and I can work with following up. Or if I get a message, I know who it's from, I can send it back to Linda to try and reach out again. So my office phone number is in my email signature, so you all should have that, but I will tell it to you now, and I'll type it into the chat box as well. My office number is 615-741-1585. So if you're not comfortable leaving your own phone number or using a voicemail, feel free to put in my office number and we can coordinate that way.
And then Wendy was asking, the folks on our list will be those who already received services from the commission, correct? Or how did the people that the volunteers are calling get on the list?
Yes, so that's correct. The individuals that we're talking are having you all call. We had over 700 from Ryan's program, the SHIP program, which stands for the State Health Insurance Assistance Program. And we've had around close to 450 other people come in from the local area agencies on aging and disability who have helped them in their programs as well. So kind of back to the programs that the commission offers, wherever that brochure is. Now, these are not all the programs that our agencies administer. There's many, many more, but likely the individuals have either received services or have called and asked about services from any one of the number of programs that we provide. So while it may seem like we're cold calling people, they have contacted us for one reason or another to be added to this list.
Okay, so I think at this time, I tried my best to keep up with questions that weren't answered in the presentation and asking them out loud now. But if for some reason I missed your question, if you wanted to unmute and ask Sydney, that might be a good time to do that.
Yeah.
I have a question. This is Jackie.
Go ahead, Jackie.
So when we go through the entire process, we get them signed up on the tn.gov, the immunization website.
Mm-hmm.
What will the website look like when they're getting their confirmation email? I assume they'll get a confirmation email, just so we can tell them to look for that either in their regular mail or in their junk mail.
So I know it will be coming from the Tennessee Department of Health. I will work with one of our coworkers who's working closely with the Department of Health and see if we can get kind of a sample of what it will look like. I haven't been able to get past kind of the information that's needed to complete the registration. I'm going to make a note to see if we can get some kind of sample of what they'll see in their inbox. Great question.
Thank you.
I can follow up on that a little bit. It's Ellen Torrance.
Go ahead, Ellen.
I've helped about 30 people sign up. And so what I can tell you, it's a very good question, actually, because it doesn't come back as necessarily Tennessee Department of Health in the email. It might be the region, just like you have regions, Tennessee Department of Health. For example, one county came back as South Central. And so, yeah, they will need to look at it. It will be the name of, it might be Mid-Cumberland Health Department or South Central Health Department. And so that was a really good question. So that's what I know about that.
Excellent. Thank you. I appreciate it. See, if we don't know the answers, we're going to find someone who knows the answers.
Hi, this
one of you.
Hi, this is Karen Rogers, and I signed up today using the site myself. And the reply email, it says no reply VR. It's a TNDOH COVID-19 vaccination. It's kind of the heading. And I did get an email pretty quick. So, and it just said greetings and had my name. And then it was telling me what phase I'm in and everything else and on the wait list. But a question that I have was that a couple of them, if someone signed up on the old website, will that information carry forward to this new website?
So we actually had that question come up on one of our staff calls yesterday or the day before, and our coworker who's working more heavily in the vaccine since the beginning recommended that you also sign up using this site, just to verify that the name is in the system, just in case it wasn't a smooth transition over. So they were using Sign Up Genius, and now they're using a different software system, just to make sure that there's no confusion and no one's accidentally been left off of the list because of the merge. We do encourage people to sign up again using this new site.
Okay, so if someone tells us that they signed up a week ago, they likely use the old system. So we will sign them up again.
If they give you permission, yes, I think that would be a good idea. If they use the Department of Health's website, if they signed up maybe for one of the new pharmacy programs, I know Walmart's maybe having some signups going on. If they signed up for a source outside of the Department of Health, then they can contact that source directly. But if they signed up through the Department of Health, yes, we're going to ask them to see if they want to re-register again, just to be on the safe side.
Okay, thank you.
Good questions. Tough questions, but good questions.
Hi, this is Elizabeth Yates.
Hey, Elizabeth.
Hi, I just have a question regarding the race on the form. If they do not want to complete or answer the question, can we still submit the form without that?
That's a good question. Let's see. Next, because I think it's the next form. Let's see. So when it comes to race, it says prefer not to say. So that could be an answer if they prefer not to say their age, race, or even ethnicity.
Okay.
Gender as well.
Okay.
So those, the more demographic information, that's an option to have prefer not to disclose or prefer not to say.
Okay. Okay, thank you.
You're welcome. Good question.
This is Jackie. I have one more question.
Yes.
In the news, I believe it was yesterday, they talked about you can sign up with the Tennessee Department of Health, but they also encouraged people to sign up with private practitioners. If they tell us they've signed up with a private practitioner, are we still offering to sign them up with the Tennessee Department of Health?
If they want us to, we can. I know from other programs, we've had quite a few people who have said, I'm waiting on my doctor to actually schedule. So some people may give you that response, and it's more their preference. It's not mandatory that they sign up through the Department of Health. So it could be that, okay, no problem, waiting to hear back from your doctor. If you're interested, here's the website that you can go to, or give them my office number and say, feel free to call this number if you change your mind and want to schedule an appointment, and I'm happy to talk to them.
But it's okay for us to go ahead and sign them up as well.
Yes, if they're comfortable with that, absolutely.
Okay, thank you.
You're welcome.
I have a question on, and I may have missed this, or I had to step away for a second, but for people who have a family member who's willing to provide their email, if the person we're calling doesn't have an email address, do we just put their friend or family member email down and proceed with scheduling, or do they go to a wait list?
If they have they should probably go on the wait list, just because we want to make sure the family member or friend knows that their email address is being used for this purpose, and they don't, just delete a random email that they received. So I would say, to be on the safe side, we'll put that person on the wait list and encourage them to talk with their family member, friend, or loved one to get the appointment scheduled.
Okay, so we tell them to talk to their family or friend and then direct them to the website to sign up themselves?
Yes, that's what
Okay.
I would say to do, just to make sure there's no miscommunication on emails and who's receiving what information.
Okay, thanks.
Okay, I have a quick question. I know that you're using the vaccinate.tn.gov, and I take it that's the site we use.
Yes.
But yesterday, WKRN posted an article online to use the COVID-19.tn.gov to sign up. So
yes, that is where the old vaccine registration form was located. As of Monday, they've switched to, and this is just again for the Department of Health. There's other providers like pharmacies that you can go to their websites, but specifically for the Department of Health, they're telling us to direct everyone to this new vaccinate.tn.gov site.
okay.
It was just launched on Monday, so sometimes media outlets get some information that, you know, we sent it to them Friday, but they're going to air it on Monday, and then Monday everything changes. So
I just wondered how they changed midstream, but that's not a question for you, I take it.
I would not know the answer to that. I wish I did.
Yeah.
Alrighty,
Hey.
anybody else?
Hey, this is Lynn Jennings. I'll just jump in here because I sort of have an answer to that last question. I think that the way the appointments were getting scheduled before was either a county by county situation or even a health department by health department situation. This new website is more of a statewide solution versus those disparate solutions for each different sign up. So that's what they were trying to do, is put something in place that allowed us to go to one different place and sign up versus having a bunch of different stuff going on in the background.
I thought though things were still county by county about age groups. I didn't think Davidson County was going 65 plus, although the state is. I'm confused.
So we don't want to speak on behalf of the health department. So a lot of why we think things were changed is kind of all speculation. So we can't really answer that question outright. We were sent information yesterday afternoon that starting on Monday, February 22nd, the whole state is going to be opened up to 65 and older in the age phase. Right now, our program is focused on aged based phases and not necessarily the other phases for different kind of workers and things, where you can find that information on the website. But we were notified yesterday afternoon that 65 plus will start on Monday, the 22nd.
Which makes sense that you want us to do the 70 plus now. Okay.
Yeah, so we do have a little window still to help out these individuals 70 and older. Next week, we are going to be looking at compiling lists of people that have contacted our programs who are 65 and older. So I believe right now we have a little over 1,200 people on our list. And next week, we think we're going to triple or quadruple that as we add individuals who are 65 and older. So this project's going to be going on for a couple months at least. All right, that was a really great discussion. So before we kind of head out, and I will stick around for a little while longer in case anybody else has any other questions that they don't want on the recording. But on behalf of Ryan, Nikki, and myself, we really want to thank you all again. We're getting some background noise. We really want to thank you all again for your willingness to help with this project. We have over 1,200 people to call within the next few days, by Monday. And we're going to be able to do that because of you all and your help with this project. So again, I'll start sending everyone lists of people tomorrow morning. For those of you who attended the webinar today, you guys are going to be a little bit more on the priority list. No offense to those of you who weren't able to attend the session live today, but I want to make sure everyone has listened to the recording before I send them people. But for anyone who's listening, let me know when you've completed listening and I'll send you your list. But I'm going to go ahead and stop the recording and stick around for a little while longer. But thank you all so much again, and we look forward to working with you soon.